And I'll wait till, and it says we're recording. So good morning, Dr. Tom Larkin. It's my pleasure to be here with Dr. Chris Griffin. He needs no introduction to the field of dentistry. He's done a lot of things and he's everywhere. So one of the things I'm very pleased to announce is that he's going to be participating in the Phoenix Dental Project. And I've got a couple of areas where I want him to help out. But let me give you a little backstory to today. So the American Dental Association came out with a survey, I don't know if the last day or two, about the 4 main areas of concern that dentists have right in this moment, okay? The first one is financial relief for dentists is number 1. Financial security for your staff was number 2. Dental team and patient safety was number 3. And guidelines and support for reopening the dental practice was number 4.
That's right? A big one.
Those are the 4. So I know that you're a fan of Gary Vaynerchuk, and I think you've met him. I saw a slide with you and him. Tell me about that, because I've been a fan of his for a long time.
Oh, I was speaking at a dental seminar in Dallas, Texas, I guess 2015, and he was popular, but not like he is now. And
right.
We were they had like a dinner for the speakers in the VIP room, and I was back there and he was back there. And you know what's crazy? If you watch Gary Vaynerchuk, if you listen to any of his stuff, you know, he is in your face. He is just like, you got to work hard. You got to hustle. And he's just like, but man, backstage, he was just like totally chill. Just like a totally soft-spoken, chill guy and just fun to hang around. And so, yeah, I snapped a picture with him in 2015. And of course now, as we all know, he's super famous, and I am, you know, I'm just a struggling dentist, but it's cool getting to meet people.
So I started following him probably at 2010 when he had Wine Library TV. And it wasn't that I was that interested in wine, but I was interested in the medium of video. You know, he'd just sit down and he'd talk about wine, and he helped with his dad's wine shop, right? And at the time, he was using an application called Vidler. This was before YouTube. I mean, so I've been following him a long time. And I listened to him about once a week. So this week, he's doing a 2-hour Facebook Live every day, kind of an emergency deal, whatever. And he said, you know, we need to stop dwelling and get on offense, right? So these things here that the ADA was mentioning, those first 2 about getting financial relief, that's kind of the shock phase that we're in right now. Everybody's got to try to rescue their practice and help their staff, right? And that's the shock phase. But the offense stage is the next stage. That's what the Phoenix Dental Project is, right? Where I'm trying to assemble the pieces, and the fact that there are 2 components: patient safety. So the first thing I did with the office that I managed, I became immediately concerned about the air and water, and I've been just chasing all these crazy people in the air and water business to bring a solution, right? But the next part is going to be, what does this look like reopening? Okay, and that's on everybody's mind. When are we going to reopen, and what is it going to look like when we reopen? So another person that I follow is Simon Sinek. He's the guy who wrote Infinite Game. And he had a really good Zoom meeting with his internal staff this week to talk about some things. And his takeaway point was this. He said, the question is not how we do what we're doing, but the question is how we're going to do what we're doing in a different world, recognizing that the world is going to be different 60, 90 days from now, right? So we got to shift from this survival mode. Survival mode is applying for the SBA and the 7A. That's what we need to do short term, but we got to get to the reinvention mode, right? And that's why I'm so thrilled. And here's the task I'm going to give you. I'm giving you 2 categories in the Phoenix Dental Project, which is practice management and virtual CE. And so over time, what I want to do is to use you as a resource for the fantastic portfolio that you've already developed. You're such a detail-oriented person. I mean, you've really gotten into, you've kind of carved your niche with systems and things that you're really, really good at. And then we're going to take that, and that might have to be massaged a little bit, right? You know, going forward. We don't even know. It's a very much an unknown. But what I'm doing by assembling really smart people like yourself is I know collectively together, we're both passionate about helping people. We've both done it for a long time. that we can come up with some unique solutions. So I want to thank you for agreeing to pitch in. And like I said, I put a lot of responsibility on you there, but I think you and I are both motivated by creativity.
Well, hey, I tell you, and Tom, I'm really honored and thankful you've given me this responsibility. And let me tell you guys, just speaking to all you dentists out there, we actually have an opportunity coming up that we have never had before and we will never have again. And I don't know exactly what the future is going to look like. You can rest assured it's going to be different. It's going to be different. But I guarantee there are a ton of systems and just things in your practice that should have been straightened out and hammered down and just gotten seamless a long time ago. But you know what? Times were good in dentistry. We had a really good run. And it was tough to think about systems and boring things like standard operating procedures when things are so good.
Right.
But now, if you took out the PPP loan or whatever, Steve Mnuchin told Maria Bartiromo this morning that he didn't care if people came in and sat around or stayed home, and he just wants you to pay them. That's what they want. They don't care about us gaming the system to things that are good for us. They want the employees paid. So we have an opportunity to bring them into the practice. And if there's not patient care to do, we can actually put them to work refining our systems and getting ready for when they actually turn us loose to see patients again. This is a huge opportunity, and I don't want anybody to let it pass by, Tom. So I'm excited to get going with this.
Yeah, it's such a unique opportunity, right? Because we all scramble to get any amount of time with our team, any amount of time, and now you've got a decent amount of time, unlimited amount of time in the near term. So another thing too about really nailing these system downs, because you and I have talked about my concern that on the initial comeback, things may be a little bit choppy depending on how this virus shakes out, right? So running your practice efficiently is going to be more important than it ever has been, right? So that's another reason why we need to do that.
Yeah, you're going to have to squeeze every ounce of productivity out of your team. And, hey, once these loans run out, there's a good chance that you may end up furloughing or letting some of your team members go. And you may have a very small crew. And when you have a small crew, you've got to get every ounce of productivity out of every person, including yourself. So look in the mirror, you're first, and then you got to make sure you're leading your team and you're getting everything out of your team you can possibly get. So, yeah, this is a big reset. They called it the Great Cessation, the Great Reset. I don't know what other names they're going to come up with, but this is for sure a once in a lifetime deal. And if you're one of the dentists out there that take advantage of this and you're on the leading edge, you're going to be way ahead of everybody else. Let me just tell you.
Yeah, I see some of the corporate entities. I think they're going to struggle just from their sheer size. All of that stuff that they use to their advantage, being big and buying power. Now they're going to have management issues, right, with HR, because you and I talked about what is the new policy for being sick, right? Is it 14 days out and then 2 negative tests if you have a cold? Those are all very disruptive things. And so I have a specific person that I'm going to task for HR, because I think HR is going to be a big enough headache in itself. But all these pieces together, and the other thing that we had talked about before too was cross-training, because I know you believe in that, right? Every office. But here's what I'm broaching. I'm broaching the possibility of including the hygienist in that cross-training, because they've always had kind of a different niche. And I use the word being flexible. We may have to have that hygienist be more flexible because we don't know what that schedule is going to look like, right?
Right. Oh, listen, they're going to have to be. That may be our biggest resistance point, is trying to get the hygienist, because my hygienists are wonderful at cleaning teeth, but that's their thing. And I kept 4 hygienists busy cleaning teeth all day long, Tom, until this happened. There's no way that I'm going to have 4 chairs of hygiene going all day, every day for a while, right? So some of them are going to have to learn how to clean teeth. Some of them are going to have to learn. I've already cross-trained. I have one assistant one hygienist who also assists, one hygienist who also does all the front office stuff. She can do treatment plans and run the software. Listen, this is our opportunity. We're going to have to do some cross-training in this interim period. Right. And the team members who adapt to the cross-training the best, that's going to be the ones that stay with you if you have to trim things.
Yep. They will self-select. Yeah. So once again, you know, you and I both look at this as a challenge, but it's an opportunity. It really is.
Oh, greatest opportunity of our professional career. It really is.
Yeah, very good. Well, I'm so happy to have you on board, and we're going to progress with this, and you're going to see a lot more, Dr. Chris Griffin. Thank you.
All right. Thanks, Tom. Looking forward to it.